good morning officially. And Federico, please kick us off.
Absolutely. Thank you. So good morning, everyone. It's great to see you all here. Thank you for taking the time during this busy holiday season to join us for this crucial conversation about the future of mental health in our community. My name is Federico Rios, and I serve as the Senior Vice President for Community Programs and Engagement with the Robinson Center for Civic Leadership. The Robinson Center, formerly named for Sally and Russell Robinson, two of our community's most impactful and respected civic leaders, is the foundation for the Carolinas Community Convener. The center centers community in all it does. It does so to help address our region's greatest needs and opportunities through innovation and collaboration. We're in the exciting process of reevaluating our approach to this important work through the incredible leadership of our president, Laura Yates Clark, who stood up just a second ago, and look forward to connecting with each of you, seeking your input through this process. More to come very soon on that. Please stay tuned. Today, you've joined us for our second FFTC Connects event. FFTC Connects advances the Foundation's mission by connecting fundholders with community causes, emphasizing the importance of understanding the interconnectedness of various challenges and opportunities within our community. These quarterly discussions on community issues are an opportunity for our fundholders and treasured community partners to gain greater insight and perspective on new approaches to complex challenges. As a former case manager, actually, interestingly enough, one of the folks that walked in used to be with me as a case manager, so that's great, and qualified mental health professional. Today's discussion is near and dear to my own heart.
I don't think you're supposed to talk about your case.
Oh, no. We case manage together. No, not breaking HIPAA today. All right. Today's panel includes some of our community's most valued sector leaders who will discuss the groundbreaking ways they are making an inroads to solve these difficult challenges. Moderated by our visionary leader, who's dressed wonderfully, and CEO Cathy Bessant. Today's panelists are Michelle Hunt, the Executive Director of the Steve Smith Foundation, Dr. Alyson Kuroski-Mazzei, CEO and Chief Medical Officer at HopeWay, and Oshel, Senior Vice President for Community Health and Wellbeing at Alliance Health, and Kate Weaver, Executive Director of NAMI Charlotte. Thank you again for joining us and for your commitment to our community.
All right, good morning. So I've been at the foundation as its CEO for 15 months now. One of the things that has become very clear to me is that all of you as the community want better connections between donors and causes and donors. We've not historically done a lot of that as the foundation. So I wouldn't go so far as to say this is an experiment. This is a learning journey for us as we try to figure out how we can elevate important causes, but also connect funders who may be interested in those important causes. If there's anyone in this room who can say they have never in their entire life had a mental health moment or a mental health journey, I'd kind of be saying you're not telling the truth. This is a real set of super important issues, and any path we have to the future, whether it is education or housing, or if it is growth and leadership and economic vitality, all of those things connect to having a super healthy, super connected set of people who on an academic day might say a population, but in the real world of every day we should think of as our community and of each other. So I'm thrilled to have my panelists here. I'm going to do my very best to keep the conversation moving. I am the queen of super long answers, so I am not going to probably not have any answers. I'm going to ask questions of the experts and connect all of you to what they do and why it's so important. So we'll go for the first question. We're going left to right, a couple of minutes on your organization, and about a minute on why it's important to you personally.
Okay. Well, good morning, everyone. Thank you for allowing me to be here with you in this great panel. My name is Michelle Hunt. I'm the Executive Director for the Steve Smith Foundation. Our foundation has been around, believe it or not, for about a decade, although maybe just more recently been a little bit more visual in the community in terms of people hearing about us. But the foundation has been around for quite a while, obviously started by former Carolina Panther Steve Smith and his family as a way to give back to this community. And we started out with a program still actually in existence right now over off of Central Avenue. It was known as the Smith Family Wellness Center. And it started out as just a facility supporting counseling services for domestic violence, because that's really something that Steve has been very open and transparent about in terms of how it's impacted his life and really why the foundation got started, but also providing primary care services. And so that program is still in existence. It's now in partnership with Charlotte Community Health Clinic, and they're providing those same services as well as dental services. The foundation has also done a number of other things and really is just at the forefront of kind of bringing collaborative partnerships. And you're going to hear me say that a lot because that's really what our foundation is about, is collaboration. We are not, as a foundation, mental health experts or experts in any specific expertise, but we are experts in bringing communities together, in providers and those that want to make a difference in the community, bringing them together to the table to be able to move the needle and trying to get work done in the community. And so it's important to me, particularly as it relates to what we're doing now in our Smith Family Behavioral Health Urgent Care, which I'll talk a little bit more about here shortly. But because mental health is just what you said. It doesn't know age, it doesn't know gender, it doesn't know race, and I would agree that probably we can say conclusively has somehow touched, impact, will everyone in this room. And so it's important to me because I'm not doing this work just for the community. I'm doing this work for me. I'm doing this work for my children who have the ability to have access. I'm doing it because it's important to talk about, and it's important to actually do the work to get it done. And so at our foundation, we roll up the sleeves and we get it done. We work to get it done.
Thank you. Hello. Thank you again for including us here today. I'm Dr. Alyson Kuroski-Mazzei. I am the CEO at HopeWay, but also the Chief Medical Officer. I'm a physician by training and board certified in psychiatry, addiction medicine, and forensic psychiatry. And so I was recruited here by Bill and Betsy Blue, who had the vision to launch HopeWay here in our community to fill the gap between the hospital and home. And so we have really strong outpatient services and inpatient services, and of course, over the last 10 years, many other services. But at the time we launched HopeWay, there really wasn't anything for people who needed extended care. You know, if it's a mother struggling with bipolar disorder and she's been hospitalized, she's not ready to go home in 4 days and care for her children. And so what could we do in terms of filling that gap? So we started 10 years ago and launched a residential program here in South Charlotte, and it's for adults 18 and above. It's 24/7, led by a medical team and nursing team, and it's voluntary. So we can prevent hospitalization if somebody is having symptoms of depression, hypomania, mania, trauma, but we can also be a step down from the hospital. So a lot of our patients come from the inpatient units at Duke, UNC, Atrium, Novant, and our surrounding hospitals. And then we have day programs for step-down programs. And so we have, 5-day programs. We have 3-day programs. During COVID, we launched virtual programs. We then saw a need for continuity of care. So we opened an outpatient practice to serve those who need ongoing support because these are lifelong chronic diseases. And as of January 1st, we're now in network. So I'm so excited that all of our services now are in network with all the major insurance carriers. And we know access to mental health is difficult. We were just talking earlier about how long it might take to get into a menopause specialist. But it before HopeWay was here, it took 2 months, 3 months, 6 months sometimes to get into a psychiatrist. And so we are the premier mental health organization here in Charlotte. We are a nonprofit. We are physician-led. We now serve teens. I'm so excited. Last year, it's about almost a year, we launched a day program for high schoolers and middle schoolers. And these kids are struggling with depression, PTSD, domestic violence,
substance use disorders, alcohol use, cannabis use disorders. We're seeing a lot of cannabis-induced psychosis and cannabis-induced mania. And so we're also doing a lot of education in the community about, the effects of these substances on the brain. But essentially, we're just here to fill the gap and to look at what services are needed and to be able to provide premier psychiatric treatment. And so all of our providers have been recruited from Duke and UNC and are really experts in their fields. And we're just glad to be able to treat people who have mental health issues and their families.
And 1 minute on your personal love.
Yeah. So I grew up with a family member with bipolar disorder. And it was very difficult on my loved one as well as the family. And so I just saw the need for top-notch access to care and quality care. There's a lot of care out around the world that's not quality. And so we're really focused on evidence-based treatment and what the research shows is most effective for people with mental health disorders. And so I just have a family passion and a personal passion. And I think it's fair to say that all of us will be affected in one way or another, whether it's our family members, a neighbor, our spouse, ourselves, whether it's ADHD or Alzheimer's disease or depression. These are all brain diseases. And the more we can talk about that, just as we do our cardiac health and diabetes and other medical problems, I think the needle can be moved.
Thank you.
Thank you. I'm Ann Oshel, the Senior Vice President of Community Health and Wellbeing at Alliance Health, and I have been gulping pollen all morning. So at some point, I apologize now if I hijack the microphone or anything like that with trying to breathe. That we're a little bit different. Alliance Health is the Medicaid managed care organization serving the citizens of Mecklenburg County and 6 other counties. And those that are without insurance. So we serve the most vulnerable living in communities, those living in homelessness, those returning from psychiatric hospitals, other types of institutional care. And a few things about kind of Medicaid, besides what you're hearing at the federal level, which would be a whole other conversation. When we think about Medicaid, and when we think about healthcare in general, we have really evolved over the last decades, and Alliance is a good example of where we have evolved as a healthcare system. We're always very interested in access to care, network adequacy, quality care, how to, depending on where people live and the stigmas attached culturally and otherwise to people recognizing that they might need some professional help. And this is part of my personal journey and a little of where we have led Alliance, especially with our community partnerships, is that it's important to be in the places where people live. To travel, whether you're in urban or rural county, to travel outside of your safety zone, to talk to a psychiatrist. That's intimidating enough just to talk to a psychiatrist and think about medications. But if you have to travel 30 miles to also a place where you live that is so unfamiliar and without your support system, we just found that gets to be even harder for people. So it's important to us, as we have really been here in Mecklenburg for about 3 years now, to understand the lay of the land, the partnerships, the non-traditional ways that people access care. We're now helping people access care through food pantries. We're helping people access care through school systems. And so we will certainly always have our bricks and mortar clinic and give people an appointment and hope that they come. But now, as part of your screening, we're saying, do you have transportation? Would you like anybody to come with you? Would you like to talk to anybody else at Alliance prior to that appointment to learn more about what's going to happen? So that connection, that personal relationship. One of the interesting things that's happening in healthcare, particularly in Medicaid now, is what we call whole person care. And so if we would have had this conversation a year ago, I would have talked all about the behavioral health care services that we provide. Those for people that have mental illness. There's a difference between people's mental health and somebody having a mental illness. But we would talk about access to care in our network around mental health, substance use, and intellectual and developmental disabilities. Now I'm talking about people's physical health. Took us a long time in healthcare, especially in behavioral health, to realize that you cannot treat the mind and the body separately. And so now at Alliance, when we talk about whole person care, that means we are authorizing, and we have a network of providers that do pharmacy, nursing, physical health, behavioral health for people that have chronic and complex and costly disorders. And we buy health. We don't just buy healthcare. We pay for health. And when we pay for health, that is the mantra of housing is healthcare. It's the mantra of food is medicine. It's the mantra of transportation is social connectedness. We ask questions now about your friends because there are studies out there that show the correlation between medication adherence and having a friend to call when you're having a good day or not. And so those are questions that 2 or 3 years ago, we would have never asked. We wouldn't have asked if you can pay your rent. We wouldn't have asked, do you have family nearby and what's the quality of those relationships? So we've come a long way. And to be a payer of services, we have our population that can access services, engage in services in typical and traditional ways. And it's that 10 to 20% of the population that we serve that if you walk in Uptown, you will see the people that we serve. And to think about the different ways now that we engage everybody. I mean, I think I hope we're still in a world where we say all are welcome. But it really is, we're not going to overlook the people that need the highest level of care in ways that are not typical and traditional of how you access services. So that's a little of what Alliance does. We've invested over $8 million to create access, low barrier access to housing for people that have criminal records and eviction histories and insufficient income. Just in Mecklenburg alone, pay over 500 landlords as part of our rental assistance program to keep people safely housed. We have a team of inspectors that make sure that people are not living in substandard housing that exacerbate health conditions. We also have a team that enforces fair housing because people with disabilities are often discriminated against and marginalized in housing. So all of these things that, again, a year ago, 5 years ago, we would have never been talking about this. And I can certainly talk about the typical Medicaid system and behavioral health system and what we pay for and how we pay for it. But really the most exciting evolution of the work that is happening in communities now through partnerships. I mean, when Alliance first came here, Steve Smith Foundation was part of our first conversations as they were funding the first behavioral health urgent care system that creates an alternative to the emergency department for people experiencing a psychiatric crisis. That's really freaking exciting. So we don't want to fill up our emergency department.
Perfect. Thank you.
Hello, everyone. I am thrilled to be here. My name is Kate Weaver, and I'm the Executive Director of NAMI Charlotte. NAMI stands for the National Alliance on Mental Illness. We are the oldest, largest grassroots nonprofit in the country dedicated to supporting anyone affected by mental illness. And we do that 3 ways. We have support. We try to make the community aware of mental health and how to support each other, and we educate. We don't diagnose, we don't prescribe, and we don't treat, but we fill the gap with support with all of these free services. And NAMI has been in Charlotte for 30 years, but largely a secret. Before last year, it was a 100% volunteer organization, which meant it was only as strong as its best volunteer, who eventually got burnt out. So we studied other cities and found that our agency needed to be much bigger, much stronger with staff in order to serve the community the way we felt the community needed us to be here. And so as of last year, I'm the first executive director, and now we have additional staff. We've expanded programming, and excitingly, we are partnering with everyone on this panel. We are supporting the work that this panel is doing. Personally, I've come to this work as a mom. I have a daughter actually 2 daughters who struggled mightily with their mental health challenges growing up here in Charlotte. It was lonely, it was exhausting, and quite frankly, at times, it was terrifying. I have a daughter who tried to die by suicide multiple times. And throughout that journey, we never shared what was going on with our friends or family for fear of, number one, privacy, but number two, not being understood. And the few people I did share our journey with, they would say, oh, tough love is going to work, or, just walk around the block and your daughter will feel better. So when I found NAMI and took the signature class called Family to Family, it changed my life and my family's life. My husband and I learned how best to support our daughters, how to communicate with them, and really importantly, how to support each other, take care of ourselves. But the magic of all NAMI programming is the people in the room. And I know the panel knows, when you start talking about mental health in a safe space, it goes deep fast. When people feel like they can share their journey, they want to. As a matter of fact, I was in a meeting earlier this week with a gentleman who was CEO of a very, very large Fortune 500 company. And he shared with me that for 28 years, he had experienced severe anxiety and depression and did not know it until his boss said to him, here is the card for our EAP program. I think you might want to give them a call. And that conversation, that 5-minute conversation, changed his life. And he did take advantage of their support and then left that company to start a nonprofit, which is how I got connected with him. But it just underscores the importance of having these conversations. We teach the community how to have these conversations, when to have these conversations, and how to support one another in the mental health so we can make a stronger and healthier community for all.
Okay. That's it. I'd love you guys are doing how that can be. All right. So these are all illuminating, really important, and I appreciate everybody for sharing. Michelle, you do something at the Steve Smith Foundation that's very unique, which is you believe in peer-led assistance, help, dialogue. Tell us a little bit about what peer-led means to you.
Well, really, and I mentioned this earlier, our foundation is in a very unique position in that because we aren't experts, we do rely on collaboration. So when we were starting the behavioral health urgent care, which, can I go ahead and share what that is? Please. Awesome. So the BHUC, we call it for short because I'm learning acronyms. It was one of the scariest things when I first got into this, all these acronyms in the medical field. But a behavioral health urgent care is basically the easiest way I can explain it is the concept of an urgent care, just specifically for mental health and substance use disorder. So you have access to the Smith Family BHUC 24/7, 365 days of the year, 3 years of age and older, and it's payer blind, meaning whether you have insurance or you don't, you have a resource, someplace that you can go to in crisis, because crisis doesn't know office hours, right? Or doesn't know, it takes you a month or two to be able to get in to be seen. Crisis is a crisis, whatever that looks like for you. And so the BHUC is available at any point for any individual to be able to walk in and have access to these services, no matter what your circumstances are. And your crisis could look different. If you're an individual experiencing homelessness, it could be just trying to seek shelter from inclement weather, whether it's too hot or it's too cold. It could be that you're a parent and your child has been having and saying things about wanting to hurt themselves, or you just have some concerns about where they're at. It is accessible to you immediately, and it is a crisis facility, so it's not meant for anyone to stay. We don't have beds, we have chairs. And so when you come, one of the most amazing things about the BHUC is that when you come, within a very short amount of time, let's hope, 15 minutes or less, the intake process has happened and they're working on diagnosis, they're working on treatment. Most importantly, once the immediate crisis has been addressed, you are very clearly aware of what your next steps are. And I think that's one of the most beautiful things about the BHUC is that for many, you don't know where to go. You don't know where to start. You don't even know necessarily what it is. You can start at the BHUC and they will be able to help you get connected to those resources. While we treat the crisis, the most important part is you knowing what those next steps look like once you leave, right? So that you are able to hopefully be able to have the resources, have the community, have the access to be able to help you with your everyday. And so that is what the BHUC is there to do, is to serve that purpose. No matter whether it's one visit or if you have to come back multiple times, it's to help get you connected. And so going back to your question, the foundation, that's not our expertise, but our uniqueness is that we don't have the expertise, but we can bring individuals such as other organizations. We work very closely with law enforcement because up until the BHUC, they did not have a resource. Jail was their resource for someone that was experiencing a mental health crisis, believe it or not. And we know that obviously jail or the emergency department are not necessarily the places where you need to go to be able to get mental health treatment. So now law enforcement has not only a resource to help people get at the true root and help that they need, but they are also not sitting 5 hours, 4 hours, how many ever hours in an emergency department waiting for an individual to be seen. They're bringing them to the BHUC, intake happens, and then they're off to be able to go and do what they need to do. We're working with the healthcare systems. I mean, we're bringing the entire community, the county, Mecklenburg County, Alliance Health, extremely instrumental in helping stand up the BHUC. And then Daymark Recovery Services, who is our actual operator of the BHUC. So when I talk about collaboration or peer-led, it's really that we rely on those providers, those organizations that have been doing the work, right? That it's not like the foundation started and all of a sudden said, oh, you're doing great work. They've been here all along, but we're in a great and unique opportunity where we can bring different aspects together to actually move the needle and get the work done. And I think that's why we were able to bring Mecklenburg County's first behavioral urgent care here to Mecklenburg County, because we were in a position to be able to pull all of the parties involved, understand truly what is needed in the community based on everyone's perspective, bringing that together, and then actually helping to get the work done.
All right, all the way back down to you, Kate. What is, you think about innovation, you think about needs in this space all the time. What would you share with this audience?
Well, first of all, community education and helping people connect to resources are two things that NAMI prides itself on. And we know that community education has a ripple effect. If we are able to spread awareness and education, families, parents might recognize symptoms in their children earlier. Partners will know how to support their loved one more effectively. And friends may not tell you to take a walk around the block. They may give you resources to find help. On a broader scale, when we educate the community, fewer people are in the ER, fewer incarcerations based on mental health concerns. And then in schools, in workplaces, in faith communities, we are there, all of those places, to educate and spread awareness to start the conversations around mental health. But one of the most exciting things NAMI Charlotte is doing in the innovation space is we recognize that access to care is the number one barrier for people getting help. As a matter of fact, when someone starts to experience any sort of symptom for mental health, for mental illness or mental health concern, from that point to getting help, the average is 11 years, which is horrifying, quite frankly. And why is that true? Many reasons. Number one, oftentimes mental health concerns start showing themselves when someone is a teenager. And parents are thinking, is this teenage behavior or is this a mental health concern? Cost, confusion, and stigma, especially in communities that are Black and Brown communities, the stigma is much higher. So we want to take those barriers away and connect people. So we search the country because we don't have a way, a one-stop shop here in Charlotte to go to find a provider. I call it the Whisper Network. Usually, if somebody has a child struggling, they'll say, wait, don't you have a friend of a friend? And didn't their child struggle? and then you end up calling that person. Well, that is not an effective way to have our community find services. So NAMI searched the country. We found that in Dallas, Texas, they have something called the Mental Health Navigator, and it's been highly effective. And so we called, it was the Grant Halliburton Foundation. We called them and we said, hey, we want to bring this capability to Charlotte. We need it here. And we've been working with them for the last several months. They ironically said to us, well, we're glad you called because we want to share this this capacity with other communities. And so we raised our hand and we said, we'll be the first expansion city. Could we afford it? Absolutely not. Did we know what we were getting into? Absolutely not. But am I thrilled that we're doing it? 100%. So this is how it works. It's going to be called the NAMI Navigator Charlotte. The first 4 tiers of support. The first is a website. You go on the website, you put in your age range, your zip code, and your diagnosis, and providers will pop up that who are near you. You'll see what insurance they take, how many providers work there, what their specialties are. However, we know that sometimes in a crisis, people can't even Google. And so we are currently recruiting volunteer mental health navigators. They will go through 32 hours of training, and then they will take shifts during the month. And when their shift is on, they will answer our helpline, and they will help navigate for that individual or family to get them connected. Whether it takes 1 phone call or 5, the navigator stays with the family until they have an appointment. We know from the Dallas model that 67% of people who use that navigator get an appointment. And in the mental health space, that's very, very high. The third tier is social workers. We can't afford it right now, but our hope is to hire social workers to help us case manage and help people connect to the resources they need and support our volunteer navigators. And then the final piece of the puzzle, which I'm so excited about, 3 weeks ago, we opened a resource center in Charlotte. It's one of the first of its kind in the country. Most NAMIs don't have one, but we felt it was critical to have a space where people can come in, talk to a navigator, or come in and sit on the couch if they need to, take a breath. NAMI wants to be the hug that surrounds someone when they're struggling and support all the people who are involved in the system and are confused and scared and truly exhausted. So we're really excited to launch this program. The website launches in June. We hope to have our navigators up and running by July. And our goal is to have 100% of Mecklenburg County mental health providers, addiction providers, and wraparound services as part of this tool so the whole county becomes healthier. Woo! So it's done.
All right, I'm going to, I want to open up for questions in just a moment, but I also think that part of what we're here for is a connection and a reason, which is, so Dr. Alley, tell me, if you had one thing you would like a funder to think about, what would it be?
To think about if you had a family member and you wanted them to have the best care possible, what would that look like? And I think sitting here listening to all these amazing programs, Charlotte's a leader in this field. I am so grateful to be sitting here right now. And so if you're thinking about mental health, any one of these organizations deserves your attention. The conversations that we're having today are so important, and I love what Alliance is doing. When we look at suicide prevention and we have somebody at HopeWay who is thinking about death and actually has had a plan to die by suicide, if you can get them medically well and psychiatrically stabilized, but you're not looking at housing, employment, relationships, family support, you're missing the boat. And so all of these things are important, and we can't do everything. Like, we can only do so much as nonprofits specifically. And so as a donor, as a funder, just think about your money saving lives. This money does save lives, and getting people access to care, preventing suicide, helping people live their most optimal life professionally and personally, and making all of us healthier. And I think looking at the mind-body connection, HopeWay was the very first medical home in the region, from like Atlanta to Florida, where we were looking at the medical care. So we have medical clinics in our practices So we're looking at the medical care, the psychiatric care, and the substance use disorders, because if we're not looking at all of those things, it's a risk for relapse. But we have to be looking at housing. We have to be looking at relationships. We have to be looking at social media. We have to be getting access to care. And so as a donor, as a funder, just really think about the importance of this work because it's saving lives.
And one or two sentences, a donor, you've got 30 seconds with them. I was just in that situation before I came upstairs today. What is it?
So I would, and Alliance is not a nonprofit. We are in the government, so I don't ask for money very often. I usually am the one that helps write the check. But what I would say,
but you got 3 other friends here.
That's right. That's right. And I mean everything. And we know the price tag of a BHUC, and Charlotte needs 5 more of them. We have 1 that serves a community of millions of people. 1. So we could use 5 more. We don't. In all of the other communities Alliance serves, we have facility-based crisis, which has beds for people. So people can stay 7 to 10 days if they need longer-term care without going to the hospital. I would say you fund the good. There is so much good out there. There are good people doing good things, God's work, all the time, including everybody on this stage. And, and I will just say, even though we're being filmed, Alliance serves 6 other counties. This is the strongest NAMI chapter that we have in any of our counties. So it really, it is a model for the safety nets that we need to pay for, because otherwise we are asking people to go into costlier types of care that usually are not always kind of the most helpful. I mean, we outpatient therapy, which is the lowest level of service, being able to talk to a therapist, our data shows that people will come twice before and so they need help. They need help staying, they need help engaging in different ways in different spaces. So fund the good, because take your pick. There's so much. There's good on this stage, and there's just a lot of good, and we got a whole list of good in case you need help thinking about the good.
One thing that I'm hearing from all of you is that the hardest thing is to ask for help.
Yeah.
Right. So safe places to ask for help. That's what you're talking about. All right. I'm going to open the discussion to questions from our audience. Tim's got a microphone. We've got a couple of microphones, I hope.
All right. Good morning, and thank you to you all. Shanavia Montgomery with Caring and Proud Alliance Health board member here, and really proud of the work that Alliance has engaged in since becoming our LME here in Mecklenburg County. We know that housing is a very critical issue, so I want to ask you to highlight how that particular social determinant of health area and goal is impacting you as a managed care organization.
Sure, and while you're all thinking about your answer to that question, I want to commend Caring. As some of you know, my husband was on the board of Caring for many years. He's a former military pilot, a veteran, and can't say enough about how much and how important the work of Caring is. So thank you for being here. Thank you for asking the question. So we'll take a couple of answers.
So Caring is an example of fund the good. Definitely. So a couple of things, as we think about how we design systems for access to care, both kind of geographically, as neighborhood-based as we possibly can, as pilots. The BHUC was a pilot. We knew things would work. We have a couple of strategies with housing, and just yesterday we held an open house for our first transitional housing program here in Mecklenburg that will serve 12 people. In this program, law enforcement, medics, hospitals, street outreach teams can literally take somebody from living in a tent to this transitional housing program for a few months. The end goal of that is always to get people in permanent supportive housing. People have tenancy rights. They should have the same privileges that everybody else does. So that is kind of one example of another strategy. we are big on eviction prevention and we are big on rapid rehousing. So we know that whether they're coming to HopeWay, whether they're coming to Care Ring, when you are living in homelessness or cost-burdened rent or substandard rent, you're not thinking about getting to your next appointment. You're not thinking about, being a patient parent, with a child that may be struggling. You're just thinking about how you're going to survive. And so for us, we really want to treat people's environment and take that stress away, and then talk to them about their diabetes, talk to them about their bipolar disorder, talk to them about their addiction. And so we will have, if somebody's particularly medically vulnerable, we'll pay for them to go to a hotel for a while until we can help them sort it all out. Now we have this transitional housing program. We have other North Carolina's under a couple of federal lawsuits for the institutionalization of people with disabilities. And so, creating low barrier access to housing, even thinking about our emergency shelter situations, way to make that more therapeutic. So people aren't just coming and hanging out, getting out of the elements. They're actually getting help and access to services. So lots of ways, and we hope there is way more to come. Another really important part of funding the good, because these are not inexpensive programs, but they save lives. They save money in the long run. We have a gentleman that was one of the first referrals to our transitional housing program, and his hospital costs in the last year were over $500,000. So to be able to have him go to a place that is costing almost nil, as opposed to a $500,000 price tag of pro bono care.
Michelle, anything you want to add to that?
Again, I think it's fair to say, particular for in mental health, right? There's the root of the situation, whether it's financial, whether it's housing, whether it's many things, right? And that is one of the things, at the BHUC, while we're dealing with the crisis and just trying to stabilize the individual, that's the importance of us having the collaborative relationships and partnerships and conversations, because while that is the immediate crisis, to get at the root of it, I talked about, trying to get that individual on their feet. That is where you really need to go. And that is something that, at our foundation, again, we are not, but we continue to have these conversations and we have these partnerships. Daymark works very, very hard with other providers, with Alliance, to make sure that the individuals have those resources, because the next step might be, if it's deeper rooted, it's related to their housing situation. It's related to employment. It's physical. It's all of those things. And so, to just add on the importance of really the whole individual look at how mental health impacts people, but where is it really rooted, and how are we making sure that those individuals are connected to those particular resources?
I think great points. Next question.
Hi, Miles Atkins from Iredell Health Foundation. Just want to follow up on what you just said about getting connected to resources. Can you all share a little bit strategies or ways that there's a lot of resources, but people actually finding the resources, being aware of them in the community? Are there boots on the ground going into certain communities to help people know what resources are available and how they can access them?
So I'm going to start. Actually, that's why we're here today, to begin the conversation about causes and an understanding and a buy-in and really an emotional connectivity to causes, but also to funding. The Foundation for the Carolinas has 3,100 fund holders. Several of you are in the room today. If you're not, you have the opportunity to see this discussion. And our hope is that by raising awareness of where the actual opportunities are to give resources and make a difference, our hope is that we start to stimulate that conversation. So that's why we're here today. I'm going to give everybody an opportunity for like a real quick answer to the question, but Resources are the ball game here. They are. That's why we're here.
So at HopeWay, our admissions department is staffed with licensed clinical social workers. And so you can call HopeWay and talk to somebody who has a license, and they can help triage what might be helpful. So HopeWay may be an answer, but possibly, a substance abuse recovery program might be the answer, or maybe an eating disorder program might be the answer, or housing might be the answer. And maybe somebody needs immediate help, and the urgent care is the answer. So they are available during the day, and then Atrium is our call center in the evening, and they take all the calls as well. So they can help you, figure out what might be helpful. But this navigator is really going to be helpful when that's online, to be able to show you, where to go and what might your insurance cover. And if you don't have insurance, so HopeWay has a health equity arm where we work with Novant at the Hope Community Clinics and the Michael Jordan Clinics for people who don't have insurance, who come from other countries and maybe don't even speak English. And so not everybody knows that. So I think talking about these things, raising awareness, reading people's newsletters, talking about it, sharing this at the dinner table with your friends, the best thing we can do is just talk about it, normalize the conversation, and then just know all of us can be helpful in whatever way we can be.
And again, to your question, resources make a difference, right? This conversation only continues and gets bigger with those kinds of discussions.
I'd like to add to that. With NAMI, the way we're sharing resources and building resources is through community partnerships. So for example, all of our programming is done by volunteers, and they're peer-led, people with either personal experience or a loved one who has had mental health issues. 2 people at HopeWay just got trained as NAMI support group leaders. And so we're starting a support group for families at HopeWay. We're partnering with Michelle to do more programming at the BHUC. And we've got a partnership with the YMCA. They give us free space for our programming, and that allows us to get into all around the city. So we're constantly looking for more partnerships to spread awareness and also just build our group of volunteers. Last year, we had about 3,200 hours of volunteer hours, and we're expecting to double that this year. So we're growing very quickly. But to the donor question, I would say NAMI is one of the very few organizations that actually affects everyone in the community. So when you are investing with us, you are investing in your own family, your own workplace, your own faith community, and we're here for it.
Question.
Good morning, everyone. Leo Scarpati with Blue Cross and Blue Shield of North Carolina. And I just had to write it down just to make sure I got it out right. So understanding the challenges to access in terms of mental health services, can you share some of the differences in addressing youth mental health compared to working with adults?
Yeah, so we just launched a youth program this year, and we are partnered with Blue Cross Blue Shield, and we serve probably 50% of our group is Blue Cross Blue Shield. Our kids are really struggling. So we serve 12 to 17-year-olds in our day programs and people as young as 4 or 3 in our outpatient programs. These kids are so young, and the exposure to everything that's going on in our world, social media, some of them have been through COVID. There's domestic violence at home. They have ADHD, maybe depression, bipolar disorder. They're vaping, they're using alcohol or worse things. They're very complicated. And when we started this, we knew that, but we underestimated the level of acuity. So we need more services for children in our community. And I know there's a lot of organizations working on that right now, because the younger we start serving our kids, the better in diagnosing things. I mean, oftentimes it can take 7 to 15 years to get a diagnosis of bipolar disorder. Well, these kids are having symptoms in high school or maybe college. And if we're not intervening early and getting the proper treatment in the treatment plan that's most effective, it is a huge risk for suicide. So our kids are really struggling. And I'm so grateful that we were able to, with community support, because we had to raise money to launch our program on Monroe by the Home Depot. But these kids are amazing, and they're really doing hard work. But it's also scary because, when they're ready to leave, they're like, I don't want to leave. I don't want to go back to school. I don't want to go home. It's not safe. And so we have to work with the families and the schools with that transition, and so that they feel like they are supported and listened to, and that they have a safe place. So there's a lot more work to be done.
I'll piggyback on that. What we see at the BHUC, we see obviously a majority adults. We do, as I mentioned, have access for children. We work very closely with DSS. So we do have a really strong partnership there. But one of the biggest challenges that I know that we see at the BHUC, which you've alluded to, is just having, particularly for youth, resources to connect them once they've dealt with the crisis, like what is available. And there are some programs out there, there's not enough. And that is, one of the areas that I can speak to in terms of our foundation, where we're looking. We wanted our BHUC to give us a little history. We opened in 2023. And so now we've had some data, because that's what we rely on. We rely on our data in the community to tell us what the next steps look like in terms of programming. And that is probably the main area that the foundation is looking in terms of, everyone asks, what's next for the BHUC? We've talked about, needing other BHUCs. We've talked about, well, we have one centrally located. How do we have satellite ones, right? Because 30-minute drive, if you have transportation, and our BHUC is on the transportation line, but if you can't get to us, how do we get to you? And one of those focuses that we're having right now, in addition to these satellite locations, is how do we extend programming for youth? Because we do see school-age kids. We have a lot of those conversations and a lot of those partnerships that have reached out to us asking us for resources, and we're limited, right? And we are crisis. It's a short amount of time that we see individuals, but it's probably the heaviest need that we've seen in the community in terms of needing some additional services. So where the foundation is at, kind of piggybacking on your question, boots on the ground. The foundation first wanted to get the BHUC up and running. Now that we have Daymark actually operating it, our focus is now having these conversations to find who are the other providers that we can work with, but then also what is the next step in terms of resources that the foundation kind of stand up based on the needs. And right now our focus is trying to figure out what that looks like related to youth. That's our biggest focus.
I also think as adults, we have a special responsibility to listen to cues that may not, that you see every day, that may not to laymen seem like they're cues, right? So sometimes I think that the most underplayed skill that we have as adults, and that we have as practitioners or donors or organizations, is that listening and interpretation and the reading between the line skills, all of which you've shown already this morning, which I really appreciate. All right, next question.
Hi, good morning. I think we're still in morning. Kiva Womble with Bank of America. This conversation is very necessary. I commend you all for your leadership, and please continue to stay in the good fight. We'll be here to support you as community and stakeholders. I think it's important that we continue to normalize mental wellness as an economic mobility driver. And I think about that too in terms of your reach. Proximity is very important, especially when you have someone who may be unhoused or who may be not near a BHUC or near one of your programs and services, but they're willing to respond to services to assist themselves. But transportation could be a major barrier. Or in that moment, we want to increase the show rate. So 67% rate to gain an appointment, but I'm sure the show rate is probably less than that. So tell us more about what other resources you can use. I think about community health worker programs that are instituted throughout our community, as well as other navigator systems. So what resources do you need to continue to expand that reach?
So Kiva, before you sit down, one word on the founding at EAP and what your expectation is across a super large employee base, speaking for other employers. Why EAP?
I think EAP has become a safe space for lots of employees, maybe not even 10 or 15 years ago, but now when we're having the conversation more and introducing that in front of our team members and reminding them that it's a resource, I think they become more and more comfortable with it, knowing that EAP is pretty large. And so it's not just even access to a counselor, but
life event services, et cetera. And so I think, again, we've done probably a really good job, particularly I'll speak for Bank of America, of reminding team members to use that as a resource for wherever they are in their life, whatever need that they need to meet. So that's certainly one way as well. And so since I'll take a little bit of liberty since you gave me the microphone back, Cathy.
I didn't give it to you for that long.
10 seconds. And so one thing I think as large employers and even small employers are to have those conversations with our team members, to know that everyone is human and we are all touched with this, if it's personally or someone that we do know. And so just making sure that we bring in partners like this to remind folks that through EAP or direct contact that they can have some services available.
And no judgment zone. Don't you think? I feel like that's the accountability of all of us as large or medium-sized employers. No judgment. All right, but now someone answer Kiva's question.
Can I expand on EAPs?
You can.
Okay, so HopeWay has an EAP as well for our employees. And we hired an EAP specialist to go around and meet with the programs in the community. I think one limitation just to be aware of is that sometimes they only give you X amount of sessions, might be with a therapist, not a physician or what have you. So the EAPs are helpful, but the EAPs also need to be educated, whatever platform you're using, because these are companies that can be all over the country, what the community resources are. So if you're in a leadership position at a company and you have an EAP, talking to them about the resources in Charlotte for your employees is helpful, but also not only encouraging them to call the EAP, but to call HopeWay or go to the urgent care or what have you, to utilize the community resources, because we're all funding and supporting these resources. We want our people to use them.
Well said. I think that's a pretty good answer to your question. All right, we've got time for a couple more questions, and then we're going to call it a morning. But a morning I hope you feel like, as I do, very well spent.
Good morning. Hello, everyone. I'm Catherine Kassam, and I'm on the board of HopeWay, so I say that in transparency. I have a son who is bipolar and another son who suffers from depression, and have been blessed to be able to have lots of resources to support them. But through that process, I've learned that what is really important is also to treat the family. It's a parallel process in terms of needing to learn new skills to help support both youth, adolescents, and adults through this process, as well as it feels like there's a gap sometimes for aftercare programming. It's not one and done. It's helping to keep them from getting to more severe needs again. So as I'm sitting here listening to all you powerful, wonderful servants to our community, I'm wondering, is there an opportunity for more collaboration in some way to bring some of these gaps to our community, as well as potential lobbying or coordinated efforts? But just a thought.
Yeah, so a family program that's effective is really necessary. And so when I was at Duke, we had a really amazing family program, and I'd love to bring that to Charlotte under HopeWay's umbrella. But I think we could partner with NAMI because they're the experts in helping these families. And so the answer is in collaboration and in partnering. You know, I think too, having a physician that's in the urgent care that might need to do medication management. Like there's times where the person may be psychotic or manic, and talking to a therapist is not the answer. Like they might need medicine. And so how can we support the urgent care? How can NAMI support HopeWay? How can we all work together? How can we have an alliance arm of HopeWay where maybe we have a mobile unit that goes around and meets people where they are in the community, like just take it right here and park it on the street. Like these are the things we need to do. And I'm just so inspired today by all of these organizations and women here. And it's actually kind of cool to say women. I mean, this is unique. We have a lot of powerful women in this room who are, moms and leaders, and we're here to help these kids and these adults and families. But I agree, family programming is crucial.
And if I can also address that, because even though we serve a segment of the population, it is indicative of kind of everything that goes on of families struggling to understand what's happening and access the resources. We are big believers in trust-built neighborhoods. You already trust the people who live around you, whether, again, that is a food pantry, whether that's the Y, whether that's a school, whether that's Ada Jenkins. I mean, and we spend a lot of time just canvassing neighborhoods to build these partnerships. And, I grew up in West Virginia. Everybody, all my neighbors have been there for decades, and everybody watched out. And we're not like that so much in neighborhoods anymore. And so as much as we can use these trust-built neighborhoods for family support, and we've been partnering with Enlivian in their core program to provide more youth-centric services and family-centric services in their housing communities. We're partnering with all the Ys on not only healthy eating and access to food, but you bring your child in to play basketball, and oh, by the way, go over here and let somebody know if you need a little extra help with food this month, or you need a little bit of money to pay for your medications. We're looking at having nutritionists, because you got to feel good to do some of these things. You just have to feel good with that. And one of the things that we hear both from all of our partnerships and the families and others that we talk to, they every once in a while, with all due respect, they'll say, I heard there was this new kind of family of antipsychotic medications. Can you tell me more about that? They say, I want to have a job, meaning I want to have a purpose. I want to have a safe place to live, meaning I don't want my kids to be afraid to go outside and play. I want to have a social support system, meaning I want to have people that care about me and I care about them. And then I want to do all these other things that you're offering me. And so it really has completely reframed how we think about paying for health. And, even the mobile thing, shout out to CareRing and Atrium. We're looking at mobile health screenings for people. If you can't come to us, we'll come to you. But that is not how the typical healthcare system works. We pay for a 50-minute session at a clinic. And so this is a whole different kind of reframe of how we deliver health to people, especially in communities where sometimes it's a little harder to get through the day.
Every single one of you, I know, work with CMS. You work on behalf of advocates for, but also as resources for children, right? Anyone have one or two sentences they want to?
I would like to take that one, because Alicia is starting to volunteer with NAMI as one of our presenters of a program called Ending the Silence, which is for middle and high school kids, 90 minutes. And we are currently in the discussions with CMS for an MOU, and we're hoping that Ending the Silence becomes part of the curriculum for every CMS middle and high school. So thank you for asking that, Alicia. You are absolutely right. The early intervention makes a huge difference to long-term success.
All right, Catherine, you get the last question. And again, thank you for the role you're taking on at United Way, and we are all here in support of you.
Thank you, Cathy. So, Anna, my question is for you. You and I have worked together on a program to support those who are homeless and facing housing insecurity. And when I asked you what would be one thing you wanted to do to support those who are unsheltered in our community, you answered with street psychiatry. So can you talk to me about what that program is and why that was your number one response?
Sure. So we just, the ink has barely dried on a contract with Atrium, who will provide psychiatrists that accompany the street outreach teams to people living unsheltered who have difficulty accessing care. And one of the reasons that's important is because, it is a health and safety issue for people who are having active psychosis and being able to protect themselves on the streets. It also is difficult to engage people who are too depressed to think about doing something else, have post-traumatic stress disorder, again, some psychotic disorders, or addiction services. We see this as a strategy to help prepare people for housing. And the street outreach teams are there primarily to help with housing navigation, accessing housing, for us to accompany them, to help them understand and to engage somebody literally sitting in a tent with somebody who might be actively psychotic, thinking about ending their own life or whatever other issues they're having, and to be able to treat that right then and there, and then also have that same physician and that same nurse come back and say, we started this medicine. How are you feeling? How are you doing? The complexities just to do something that sounds so wonderful is street psychiatry, and it is, as you know, because you've been on this for like a year. The complexities of how you think about providing care in the woods, how you think about providing care in somebody's tent is very different. I mean, the formulary of medicines is very different than what we might consider in HopeWay. But we think that it is like one of the biggest strategies to prevent people from dying and homelessness, and also to help prepare them for housing.
So, Catherine, a little bit of a softball from you. Catherine's in the middle of raising funding for a super important set of street psychiatry initiatives involving several of you, also involving Home for All, led by United Way, as a result of a task force several years ago that tried to look at what would happen if the goal was not to have homelessness, not to have people unsheltered in an evening. So appreciate your leadership in the question. Appreciate the answer. I, again, feel really terrible having to stand up and end this beginning of a discussion, right? And I can look at all of you and see your attention and your interest and your thoughtfulness around these issues. The role of the Foundation for the Carolinas is to convene these conversations, and then also to make sure that we engage donors in support of these incredible organizations. I cannot say thank you enough to all of you for being here. I cannot express more the goal of the Foundation for the Carolinas to be your beloved community participant and to lift voices, not quash voices. So that's why we're here. I really, really appreciate it. I don't even know how I'm going to get off this stage. I would like to talk all day. I want to thank our panelists who prepped and who are here, and I want to thank all of you.